Hello， 大家好，欢迎收看韦博多媒互动少数族裔媒体服务中心举办线上座谈会，详情请看。
Del Norte County is located in the northwest corner of California on the Oregon border. We have a population of about 28,000. We also have Pelican Bay State Prison, which can house up to 5,000 inmates. Del Norte is a rural county with one incorporated town, Crescent City. We have communities to the north, east, and south of us, all unique populations in ethnicity and culture. And these are Smith River, Gasky, and Klamath. We have one hospital in our entire county, Sutter Coast Hospital. They have a total bed count of about 60. They've converted some of these beds recently for ICU services, resulting in about 11 ICU beds, all of which currently are in use. Del Norte County began monitoring the pandemic in February 2020. Del Norte did not identify its first positive case until April 2020. Our local public health officer has released frequent updates to keep residents informed as to our progress through the pandemic. These updates have been captured on the public health webpage on the County of Del Norte website. They provide a historical record of the impact and response to the pandemic. We had our first real surge in November and December 2020. Until very recently, Del Norte has experienced low hospitalizations, and while every death is significant, we had experienced only 5 until April of 2021. Following the reopening of the state in June 2021, and after the July 4th holiday here in Del Norte, our positive cases have increased, jumping from 23 positive cases to 90 between July 15 to July 29. We began providing the vaccine in December 2020 to healthcare workers and first responders. We then followed state guidelines to provide vaccines to older populations and increased our efforts as the vaccine was more readily available and the age eligibility increased. By April 2021, we were providing 400 vaccines at each vaccine clinic. These larger clinics were provided in the Crescent City area, both at the airport and then at the fairgrounds, which is located right in the middle of Crescent City. We also provided many specialty clinics in outlying areas, collaborating with our healthcare provider partners. Much of the vaccine that comes into Del Norte County is distributed through our public health department to our partners who help with this effort to get vaccines to our residents. We have been working with wonderful partners in the outlying areas, such as True North Organizing, the Hmong Cultural Center, tribal entities such as Taloadini Nation and the Yurok tribe, and those orgs that serve the homeless populations, Mission Possible being one of those. We travel to outlying areas and also work with employers to provide vaccines while residents are at their work sites. With the recent surge, we are seeing an increase in vaccination rates, but we still have a long way to go. Most of the current hospitalizations occur in unvaccinated persons. During the last 2 weeks, our hospital has exceeded its capacity to meet the needs of the community in regards to ER services, hospitalization, and the ICU. The state has stepped in to assist us with a strike team to help the hospital with testing, vaccines, and inpatient care. Despite the surge at the hospital, however, very few patients have been transferred out of the area for a higher level of care. We're trying very hard to meet these needs locally. Our health officer imposed a masking mandate yesterday evening. Increasing social distancing is recommended and large gatherings are strongly discouraged. We held a town hall meeting last night, and community members encouraged vaccination, masking, and social distancing. The answers to bringing our current surge to an end are simple. The rules have not changed, but adhering to the rules did. We will continue to provide community town halls weekly for the foreseeable future to bring education about the vaccines, including the recent FDA approval for Pfizer. Reducing fear and myth and getting those residents who are sitting on the fence in regards to getting the vaccine are crucial. Our city mayor pro tem appealed to the residents of Del Norte County last night to take responsibility and do the right thing. Hopefully, with consistent messaging and vaccine availability, we will get more residents vaccinated.
We look at these conditions much like a drought sets up conditions for wildfire and imminent danger. And from the very beginning of the pandemic, Native Americans and rural folk in our region, which includes Humboldt, Del Norte, and tribal lands in the Redwood region. We started out, True North started out by working with the Office of Emergency Services and the emergency response teams that both Humboldt and Del Norte instituted to our people and in our communities. It has been very important for True North to pivot toward public health information and education and vaccine outreach because there's a danger, and we look to protect our people with information and relationship and building the kinds of intentional, authentic relationships that people can learn from and grow from. And this just seems like one of those times that not only the pandemic, but in our larger climate change world, we're concerned for Mother Earth, and we're concerned for one another, and we will stand with everyone in our community who will stand with us and try to learn about us, and we will work with our communities of color and our larger community as best as we can, because damn it matters to me and it matters to our children. And quite honestly, I think that even before we get to full FDA approval, that hasn't impacted us as much as getting more basic information out to people and letting people talk to us and ask their questions. We were on a vaccine outreach call 2 weeks ago where a Latinx woman said, I was here for immigration rights. This may not be my where I should be because I haven't taken a position on vaccinations. And we said, absolutely, we need you here. You have friends and family, you're a leader. If you weren't concerned about your community, you wouldn't be here anyway. Please stay. And by the end of that meeting, she was asking relevant questions and asking if she'd gotten double vaccinated, if she were to get both vaccines that were available to her, would that keep her out of the hospital? And that was only 2 weeks ago. And that information has been prevalent throughout the country for a while. But we're not making fun of anyone. We're not telling anyone what they need to do, but there is information and conversation and things we need to ask. And I appreciate that the Pfizer has been made permanent, and now they're talking about boosters, and we'll leave that to the doctors and nurses and our medical professionals. But it feels almost that even before we get to there, people have to be talking to people in their community that are important to them and influence their decision making and their thoughts and their ideas, and they need to be able to ask questions that they're not sure of the answers. And before we even get to some of the more specific treatments that can protect them.
And one of the main things that I wanted to do as being an outreach worker is kind of build those relationships up again, because I mean, it was, people weren't gathering socially anymore. And so, well, one of the ways that we can, I guess, build our relationships back up again is by, you know, having conversations with others. And so I'll speak on some of the successes that we've had. And one of the successes that we had was bringing a mobile vaccine clinic over to the Alexander Dairy, where we were able to get people during their lunch break and get them the vaccine. And I was there translating and helping out the nurses. And it was interesting hearing people's responses to why they wanted to get the vaccine. And this was back in April. And I mean, people just saying like, oh, I want to travel. I want to do this. I want to keep my family safe. And now that, you know, there's been another surge in this community, and now that it's already August and we're seeing a surge, it was interesting interviewing people yesterday at yesterday's pop-up clinic in the heart of Smith River. because the reason people are getting vaccinated has kind of changed. It's mainly out of the recent surge that happened, and because they're noticing that community members are dying from this vaccine or dying from the COVID. Me being a vaccine outreach worker, how could I have built that relationship to get her to maybe think more about the vaccine? And I mean, some of the conversations that I have with people while I'm doing door knocking or while I'm handing out flyers for the next clinic, you know, and people tell me like, oh, the vaccine is going to leave you just as sick as the virus is going to leave you. And instead of me immediately shutting them off, I listen. And that's one of the main things that I do with people. I like to listen to people. And, you know, after a while, once we become comfortable with one another, then we can start discussing maybe the other information that they're missing on the topic and how dangerous it can be to be unvaccinated and to continue going to events and whatnot. And I mean, we've really had some successes with some others. I mean, we don't ID people at the vaccine clinics, and that's one of the main things that some of the people that work at the Lily Bulbs and the dairies, you know, they're like, oh, I don't want to be ID'd. I don't want this government tracing. And we're like, hey, you can put whatever name you want. You know, we just want to care that you get vaccinated.
And so they're not, you know, these are people that have been honorably discharged, but are unable to get a hold of their records. There are the youth that are unhoused, many of them are people who have had history in foster care. I'm surprised at how many foster care people there are that are out on the street that are youth. How this has affected people, the pandemic, is they are more isolated than ever. There's a greater distrust of government agencies. Because of the disabilities, this population, many of them I've found as I've tried to help them with paperwork and things, is that they can't read. They can't read. They're very great at adapting to that. But when we give them printed out information, they're not getting it. And the ones that do know how to read, a lot of times have such a distrust with the government agency, and they're needing help more than ever during the pandemic, and everything's closed down. So they're kind of just shut in. So what Mission Possible has been able to do during the pandemic is relationship-based case management. And what that is just simply treating every person as an individual and listening, as I'd heard before from the previous person that was speaking, listening to the situations, addressing the barriers, and looking at what are the solutions and how can we best connect people, the agencies that really want to help, with people in meaningful ways. We have been able to be there for people during the pandemic and to connect them with all kinds of different services. And so we want to use that same relationship that we've been able to build throughout this pandemic. We want to be able to use that in promoting vaccinations with the unhoused.
So with the Hmong community here, with my elders, that was a big issue to begin with. But the images and the pictures that my elders and the community, the Hmong community here in Crescent City have seen from China, we took the pandemic very seriously to begin with. So a lot of the people here isolate themselves. The elders within our community, we have people that go out there and just shop for them. We had people that make phone calls to check on them to begin with. And so we took the COVID pandemic very seriously until, of course, in June, when the state opens up a little bit more, then people do go out there and continue with the rituals. But before that, we canceled all sorts of even spiritual religious rituals. Funerals, weddings were all canceled. I still have, I think, 14 weddings to go and officiate in a traditional way that we just canceled and postponed up to this point. All of the funerals have been canceled or modified. So we weren't able to continue with the religious rituals that we had been doing. But all of those were sacrifices because we knew that COVID-19 was real and it was scary. It was a dangerous thing to begin with. Within our community, we have received a lot of outreach from our Del Norte County Health Department. They're just overpouring of outreach from them. And so within the Hmong Cultural Center, we have tried to pass the words as much as we can to our elders and to the families that do not have access to Facebook or the internet. We do have a phone tree that is very effective. So we have clan leaders. So for those of you that don't know much about the Hmong community, we have clan leaders. So for me, I would belong in the Vu family, so Vu clan, and there's a Vang, there's a Hertz, Yang, Lee, and so forth. So each of these last names, we have a clan leader here in town, where if I was the president of the community before, so I just called each of the clan leaders and they would communicate to their clan members, to each of the families in their clans. And so the phone tree was very effective. We had used it before. You know, there was one time when a school that I was working at was going to be closed. And so we activated the phone tree, and it was within 30 minutes, we had 40, 50 people fill up the meeting room at the district office. So, and we still use that frequently when it comes to something important like the pandemic. So the two primary things we have activated phone trees for was for food supplement. So we could buy food and shop for the elders and for those that are that have health issues that should not be exposed to COVID outside, and for transportation for those that needed them previously for the last year and a half or so. Our Hmong community here is very close, and so now, but like some of the other folks have said, many of our elders do not speak English nor read in any language, not even in Hmong. So communication for us primarily has to be a phone call or a personal visit to the person. That's the most effective way to communicate with them.